So hi, in this video, I'll be talking to you about plastic surgery and what it really is about. See, plastic surgery is not only cosmetic surgery of the face, of the breasts and hips and thighs like that. It's not only that. That's what I used to think when I was a kid and when I was in MBBS. Till then, I used to think, and yeah, I knew that yeah, face transplantation, hand replantation, all this is also done in plastic surgery. But then the moment we think plastic surgeons, we think cosmetic surgeons. But when you want to study plastic surgery or you want to be trained in plastic surgery, you cannot only choose to do cosmetic surgery. You have to go through a lot of training and what all is included in the curriculum of plastic surgery and what kind of patients do you have to treat and take care of when you are going through plastic surgery or you become a plastic surgeon if you don't choose to go only in cosmetics. That's what I want to discuss over here in this video. So let's start. Let's start with it. So the first kind of patients that you want to be aware of before trying to think that yes, I want to be a plastic surgeon is burns. So burn patients are critical patients and they are very serious in the initial few days after a burn injury, and then later on also they are again serious and they can so they can die of infections, and in the early part they can die of hemodynamic changes. So yeah, it's a critical patient. You have to do dressings. There's pus, there's foul smelling pus and dressings, foul smelling wounds, and it's not easy to take care of them. They have difficulty breathing sometimes, they have kidney failure. So it's just like taking care of critical patients. Just like how you take care of patients in ICU, you have to be vigilant and take care of them nicely. And it's not like burn injuries are not like small burns on the hands and all. People come with almost full body burns also, in like 50%, 60% involvement of the total body surface area of the skin. And yeah, so that can be a bit stressful. And when these burn patients recover from their burn shock period, later on they'll have dressings for months and some of them require surgery. So you have to keep in mind that you're supposed to take care of burn patients. Next is malignancy. So we have a lot of malignancy patients. It depends on the hospital or institute where you are training or working. If there are other oncosurgeons also over there, they may do all that part. But when there are no oncosurgeons, then we also end up doing these tongue cancer, oral cancer, and all those things. These are also there in our curriculum, and we can do all those operations and reconstruction if required. And then we have skin cancers. So, what I actually want to tell you about in this video is that see, when we say plastic surgeons, we think cosmetic surgeons, and we think of tendon injuries and some injury and all. So we think like all these cases are very nice and fun to deal with. Well, yes, that is true for half the cases, half of our patients. It's very nice to deal with them because see, someone will come with an injury. There'll be tendon injury. There's nothing on the skin. The skin would have been sutured, and then we have to prepare the patient for surgery. And yes, the surgery period may be stressful and difficult, but before operation and after operation, it's not much of a trouble to us. So that way plastic surgery is cool. So cosmetic surgery patients, we don't go through much of trouble dealing with them or handling them in the ward. And so same goes for some of the trauma cases. But what I want to mention over here is there are some cases which are life threatening or limb threatening, and which can be a very emotional period for a patient. They can be carcinomas. There may be unexpected bleeding, and patient may lose his life. There can be serious burn patients or trauma patients, degloving injuries, and there can be kidney failure in a lot of these patients. So it's not all fun in plastic surgery. Then the other cases, so let's say skin cancer. So is how how much trouble do I feel, or how stressful do I feel when I handle or see a skin cancer patient or tongue cancer? I would say not much. I mean, it is. I'm not saying it's difficult or easy. I'm just saying how much stressful I feel when dealing with such patients. So when there's a skin cancer or tongue cancer patient, no, not much trouble. When there's a cosmetic surgery patient, again, not much trouble because we don't have to do much. What I don't really enjoy, I mean, I do it with my utmost sincerity, but it feels a little bit stressful to do dressings on small children or infants, to see them crying with out of pain when you do even the slightest of or smallest of the dressings is a bit worrisome. And taking care of burn patients, seeing patients with loss of a big amount of skin is a bit disturbing. Then you have trauma cases, then you have infected wounds with skin loss where you have to do debridement and this pus and the patient cannot walk, the patient is bedridden and they are bed sores. We have to deal with those patients. We have to deal with these patients for weeks and months sometimes. And then we have facial fractures patients. So facial fractures also not much of a problem. We just do the operation before that and after that, not much of a trouble to us. And we have trauma cases. Trauma cases can be with skin loss, without skin loss. If it's just a simple nerve injury, arterial injury, tendon injury, those are again troublesome only in the operation theater, not before or after. So that's fine. And what are the other cases? Congenital anomalies. Congenital anomalies also we have to take care of children. So again, not much of a problem, but yeah, only when we have to do dressing on the hand or ears of the small child and they are crying and tossing around. So that becomes a little bit difficult, but that's not much of a trouble, I have to say. And that's all actually. So we deal with nerve injuries in this part that's called brachial plexus injury, median nerve, radial nerve, ulnar nerve, trauma today for limbs, hands, legs, fractures of the hand bones, feet bones, facial fractures, and congenital anomalies, and tongue cancer, oral cancer, lip cancer, skin cancer, melanoma, squamous cell carcinoma, basal cell carcinoma, and yes, the biggest surgeries of plastic surgery are flaps, the free flaps. So flaps are just like flaps of flaps of tissue to cover some defect. So it can be a local flap, regional flap, distant flap, or free flap. Like I take tissue from here with the its vein artery and connect it over here and cover up some area. So yeah, when we do those surgeries can be very long, and sometimes the resection or excision of some body part and then putting that flap can take up to 7 8 hours, and those can be really long tiring surgeries. And post-operatively you have to be very careful with those patients. Those usually end up in the ICU, and we have to monitor the flap for the blood supply. And yeah, that can again be a little bit of a not so fun part of plastic surgery. You should be aware about that. And then yeah, emergency calls. So a lot of people think that plastic surgery is cool and fun, but you do get a lot of emergency and you have to do procedures or surgeries on the spot, like when you have cut fingers, you when you have deep lacerations, when you have bleeding arteries, any trauma over here at the wrist with the artery spurting and all that. So sometimes we have to emergently take the patient to the operation theater and do surgeries to save the limb or the life of the patient. And even if we don't have to go to the operation theater, these injuries are very common. Crush injury of the extremities, cut injuries. So a lot of emergency calls we do get, and we have to attend all that and do small procedures on the spot. And these small procedures are very fine skilled procedures, so they do take time. And so doing a 30-minute procedure 3 to 4 times a day after every 2 to 3 hours can be a little bit tiring. And but it's not like, though it's not like general surgery or something, that 3 a.m. or 2 a.m. a patient comes with pain abdomen and you have to do surgery at 4 a.m. Those situations are a bit rare in plastic surgery. We don't really have overnight surgeries most of the time. Those take place like once in a while, yeah. And sometimes, and surgeries can be unexpected. Let's say I'm having a holiday a Sunday, and suddenly at 3 p.m., 4 p.m., I have to run back to the hospital to take care of a patient. Those things do occur. So it's not like cool life. A plastic surgeon can have cool life after training, when he chooses to take care of selective category of patients and not during the training. So training is going to be with a lot of emergency calls. So don't think that plastic surgery will be very cool and calm. Well, you won't have sleepless nights every now and then with having to work the next day also. Well, you won't have that. It's much better that way, but it's not without emergency calls every day. So I hope you got an idea about what plastic surgery is and what to expect if you go for plastic surgery training. Or so if there's any questions, please put it in the comments. I would be really happy to answer them. Thanks for watching.